Hello and welcome. You're watching FYI. I'm Sonal, Mehrotra, Kapoor. Now, over the past 1 year, in fact more than that, we all have come to understand COVID-19 a little, but still there is so much more that is still unknown, like the long-term impact of COVID-19. And now studies emerging say that it's not just that people who had diabetes are more prone to getting severe disease, something that we've practically seen all around us, but worryingly enough, saying that even those who've never had diabetes earlier might develop diabetes as a long-term impact of COVID-19, type 1, mind you. So what exactly is this study telling us? What can we do? Does it apply to India? Does it apply to Indians and Asians, depending on their immunity? All of that is what we're going to decode on the program today. So let's get into our explainer. All right, first up, what is it that we know so far about the link of diabetes with COVID? Where people with diabetes are seen to be at a greater risk of getting a more severe disease of COVID. A study done by a group of doctors involving Indian doctors as well said that they involved about 401 patients with a median age group of about 54 years, and they evaluated some results on them. Of these people, about 189 had pre-existing diabetes and 21 had a new onset hyperglycemia. Overall, about 344 ended up getting a mild bout of COVID, while 51 became extremely severe. The group with diabetes had a higher proportion of severe cases as well. That was about 20% versus 9%. ICU admissions seen higher with people with diabetes as well. Oxygen requirements seen higher with people with diabetes as well. And about 12 out of the 15 which were seen to be most severe, 80% of those who succumbed also had diabetes. Now, apart from diabetes, hypertension was associated with higher proportion of severe cases of mortality, ICU admission, oxygen administration, and all of that. Thus, the study concluded that patients with diabetes or hypertension had more severe disease and greater mortality. So that's what we knew so far, right? But as a long-term impact of COVID, can it even lead to onset of diabetes? Well, various studies have been talking about that, and most seenly in long-term impact as well. This latest research that has come from the Stanford University School of Medicine and at the Cornell Medicine there says that COVID-19 can cause diabetes. How? Well, they believe the virus can infect the pancreatic beta cells. The virus destroys the cells in the pancreas that make insulin. And that's the COVID virus, can decrease the insulin secretion as well, thus effectively leading you to getting type 1 diabetes. Remember, type 1 diabetes not easily reversed with medication, and patients could potentially become dependent on medication for diabetes for a long haul. So that's what it is said to be, one of the reasons. But FYI spoke with several other doctors also to bring to you not just this, but 5 reasons why diabetes could be seen as a long-term impact of COVID, especially in Indians. Reason 1, as discussed already, as has been talked about in that study, there is a good possibility that a person who gets COVID-19 may have an attacking directly of the beta cells in the pancreas. Remember, pancreas, the organs on the left side of your abdomen, it works to produce insulin, and it can cause increase in glucose, sugar, and thus diabetes as well. It can also lead to not creating insulin, at times leading to more creation as well. Reason 2, let's talk about that. Well, they said it's not directly related, but indirectly, like an increase in cytokine. That's basically an enormous inflammation response that the virus induces. Remember, we've done a full FYI episode telling you about this and how it can impact your body, especially in kids. Reason number 3 that has been cited by doctors and experts is that problems of your intestinal luminal lining. A luminal lining is basically a single cell layer that forms the surface of both your small and large intestine, and they may be a factor of causing diabetes. Also, as we all know, steroids, oxygen, anticoagulation, meaning basically medicines that help to prevent blood clots, They may form a mainstay for treatment in moderate to severe COVID-19 patients. In some cases, we've already seen existing diabetes also, and even those with non-existing diabetes that might be unmasked after the use of steroids. Steroids like dexamethasone, etc., so commonly used for COVID. And then there is reason number 5. As Asian Indians have a genetic predisposition towards diabetes, and a person with COVID-19 may already have diabetes prior to the infection, just did not know about it. So that's what could be the reasons behind this. But let's talk to experts now who will tell you what to do in a situation like that.